Kasiano so ewo MBN kasamfoni so ne mum meka we say ewia pem to be kasia yensa kan e na afi ebre e ma ye ho kwan na ye to pete o man ganam ene enkofo ekro so afi ye nto akasiano so se obeka ya ananu ya ene e papa John Dramani Mahama wonam ni chief of staff so ye wia friend Julius Debra na afi wode beto Ghana fo nyina enim se obi biara his excellency enkane mampanyi na adedanko akufado enam aye akwanya so na afi ofa na djuma abra ye to abawie ye bianom onjina aye ono so ne tumi so na afi onje obi biara djuma emfa mfiri ne nsem efise wahwehwe enkata ma hwe patent entakrem enhu se enya ade a aye emra kwan so na eno ene de ye da enya ne ya opanyina wono na ukopiem ewo mrase badwafia woda edom kuma na no ye wura ye fe no Afenyo Markins wode ato Ghana fo nyina anim se ye papa John Dramani Mahama so wo hwe nyankopon anim no wode ni sesi ne bo ede eye twadua ne nsa no wode enkata esi nkata so no wakache Ghana fo se henkofo ye papa eye na dadanko akufa do fa o madwuma no waje o madwuma afiri wonsam de a ene na nyame anim ni wato emra kese e wo man Ghana Afenyo Markins ensem we no wode tudwa.
There have been issues raised about the effectiveness of the current assets declaration regime. We must take advantage of the current constitution review process to strengthen the assets declaration regime to make it more relevant to changing times. I believe that we must move to a regime where the assets so declared can be published before and after public office, so that the phenomenon of unexplained and overnight wealth obviously earned through the proceeds of corruption can be checked. I trust that a healthy debate can be.
Osahin Honorable Alexander Kwamina Afenyo Markins na sabre no nebu efunu ho pa wo bisa omampani His Excellency John Dramani Mahama se eba ne sen na enkrofo omonso ye Ghanafo na omu sefata se omonso ebeye adwuma no manya bi ahwefie ahwebusua omu wie nso a omode aboa oman no na sabre no omode yese omampani a wetwem konansen ya His Excellency Nana Ado Dankwa Akufo Ado wono ne penso ebra akakakra na wafri abenmu no na wode sankrofo no agye won tu mu se omonso enye adwuma na omoye adwumayefo enti sabre no na nka wo se anopa omosori a na nka omabo omotai omato omontai de so awie dia na cheso mbe policy omushiwu nso na omakọ adwuma mu akọ ye adwuma sise no omampani a wote so eye John Dramani Mahama His Excellency kire se sankrofo yi omo nnwuma ye de hye omonsa ne tintan ton wetwetwem enu nti waje efri omonsem a sankrofo yi sisi a ye ka unemployment association for na chese omo eka ho eno na ye opani a wono eda minority no ano anadom kuma no ewo eye mrahye bedwefie Osahin Honorable Alexander Kwamina Afenyo Markins ebisa se eba ne se ne koba ne sa na Ghana ekọ nanim nti nioma bi ti sa no ewo se ye gyan na Ghana ekọ nanim esan se sankrofo yi nso ebiri bia ha ye de epa omo no eno enkire se obi efri abenmo anase obi eti abenmo na adodankwa Akufo-Addo na edwuma obedi ye se mampani a etoso imprenu no ehyasie ewo 2021 January 7 ekopim eye 2025 January 7 enu nti no sabre na se wapa wobi ewo sabre ni mu a enye ebra na wefiri so na mmom ebra na wote so se omampani ni dia na ne die eba ne sen ni ye ka kire sankrofo ne se omonkonkotene fie enu nti mampani ni ye ya wonye na sankrofo no wonsa emfa wonyumedie enhye wonsa na wonso womra me yedwuma se ne ebe ya wonso bebo oman no na oman no akwankan na omabusua ene omwankasa nso no
se afe yewura ensem fufuro ma obekaya ukopiem ewo mfifi mantem ma yare a yefe no eye cholera sisi ade me no kasa die eyade a ate atese ewo eye mfifi mantem ma sisi ampo de enkofo enam so toaye na nanom ewo ense do na sanso na ukopiem ewo atifi atoye mantem mu mekire upper west region so a ehon so sisi ukopiem ma yare a no so ate ntese eno eye meningitis eno na sisi ade eno so ate ntese wo ho a eno so ede enkofo ekọ wo mu ekra achi eno na afi opanyina wono ena ohwe asoye ya wo hwe ya pomodin sem so ewo oman Ghana Ministry of Health eye minister woda ano no ewura eye kwabra minta akando sisi ame no ka say de akopiem ewo Upper West Regional wo hwe say yare aye fe ne meningitis no ano ebetimi abrase na no ena ananu ya akopiem ho no wo say His Excellency eye John Dramani Mahama wo de ntutu papa begu fom say de be yare no ebetimi aba fom na afi Ghana fo so yenya eye ye ho fa hodie wo gina simpies no ensem we ena wo ka kire Ghana fo
human metapneumovirus. Mr. Speaker, we have also identified a single case of human metapneumovirus HMPV in the country. Human metapneumovirus HMPV is a respiratory virus that can cause a range of respiratory illness from mild cold-like symptoms to severe pneumonia. While it can affect people of all ages, it is most commonly seen in young children, older adults, and those with weakened immune system. In response to recent increase in respiratory cases in China and some temperate countries in December 2024, as part of our routine surveillance, we commenced testing for human metapneumovirus HMPV this year in January 2025. So far, a total of 90 samples have been selected for testing, and only one positive case has been detected for HMPV. This was detected from an elderly person. Mr. Speaker, I want to assure the House that the risk of HMPV in Ghana remains low. As you can see, we have a robust surveillance system in place to monitor for respiratory viruses, including HMPV. In fact, these systems have been strengthened in recent years, particularly following the COVID-19 pandemic. We therefore assure the country that any case of HMPV will be quickly identified and managed to prevent the spread. Mr. Speaker, the Ministry of Health is fully committed to working with our partners to control these ongoing outbreaks and to protect the health of all Ghanaians. We have implemented a range of measures to address these challenges, including strengthening surveillance to detect and track cases.
Na ewo emrasebe je fie ho akra no na onyonyamfo kwabena minta kando wosan giane na so na o ka kire Ghana fo nyina ewo emrasebe je fie se sisia de cholera yare no eyade a ekọ nimpa na His Excellency John Dramani Mahama so obo no homodin se de be yade no Ghana betimi adi eso enkunim we na o mu kire Ghana fo.
In the current season, as of Sunday 16 February, we had recorded over 129 cases and unfortunately 16 deaths, while 29 people are currently on admission. The districts most affected, Mr. Speaker, are Wa Municipal, Nandoli, Wa West, Drapa, and Nandom. Mr. Speaker, despite the substantial number of cases and unfortunate deaths, I wish to assure the House and the good people of Ghana that we have made considerable efforts to keep the outbreak under control. Our efforts are paying off, Mr. Speaker. Already, a wave of improvement is evident in the Upper West region, where new meningitis cases are decreasing. This positive change follows the Ministry of Health's swift and decisive actions, which included deploying experts to support local teams, conducting a high-level visit to assess the situation and providing support, and ensuring free treatment for all affected individuals. We also activated the Emergency Operations Center for coordinated response efforts and engaged in consultations with international experts. Deployment of experts. We have dispatched a team of experts from the national level to support the regional and district health teams in managing the outbreak. Free treatment. We have exempted all individuals affected by meningitis from paying for treatment, ensuring that everyone has access to the care they need. Emergency Operations Center. We have activated the Emergency Operations Center at the national and the regional levels to coordinate the response efforts. Coordination meetings. We are holding weekly coordination meetings with meningitis experts from the World Health Organization to ensure that our response is aligned with the international best practice. Mobilization of antibiotics. We have mobilized additional antibiotics to support the regional medical